Okay, well, I would like to welcome everyone to the pre-AGM webinar conducted by Susan Harris and her team who work in Wellness in Tough Times project. I'd like to welcome Susan and her team, and I'll hand over and welcome everybody else who's attending as well. So I'll hand over to you, Susan.
All right, thank you very much. Let me get this PowerPoint going here. Maybe not quite on the right slide. All right. Yeah, so I think, team, shall we introduce ourselves as we go, or just do it all now? What do you think? We can't hear you, Sonny.
Yeah. No, first one. We can do it as we go.
Okay, let's just try to remember that. As I told the team, I'm going to forget to do that during my part, but yes. All right, we are going to get started just with our little presentation here, and then we will have time for questions and answers at the end. But Sonny, I will let you start out.
Great. Well, hey, everyone, we are thrilled to be here and share the Wellness in Tough Times and our project and some of the background behind it, how we got here. Those are the team members on the bottom. And as Susan said, we'll introduce ourselves as we go. My name is Sonny Cochran, and my focus is statewide, and it is on disaster education, preparedness, response, and recovery, and working with this team on rural mental health and wellness. I'll go ahead and let you poke the slides there. There we go. And Graham, everybody was talking about Nebraska, the state of Nebraska, so we thought we would share where we are located in the United States, about smack dab in the middle. You can see our geographic size on the screen. We put a little bit of information about our population. And as we were talking, as far as industry and ag, 1 in 4 jobs in Nebraska is related to agriculture. And interesting with our project is we were already addressing some of the issues around rural stress because of the agricultural economy. And the net farm income in Nebraska has declined quite a bit since 2008. I mean, over $800 million. So that was a real concern before we even got into some of the other issues the state has had. Now, this is kind of a cool fact. In Nebraska, cattle outnumber people by more than 3 to 1. Okay, I'm going to share a little bit about what happened to Nebraska as we were getting ready to do, we had this storm, and it's called Winter Storm Ulmer. And that began on March 13th in 2019. And I'm not a meteorologist. Don't pretend to be, but we've had a lot of information about it. And I did, if you're really interested, I put a link to the Nebraska Department of Natural Resources. They have a storyboard map with a website. It's go.unl.edu/storm-Ulmer, where you can just track this whole storm as it progresses through the state. It's a bombogenesis. It was basically a bomb cyclone where the pressure dropped really, really rapidly. And it came through Colorado, and then it hit Nebraska. And what was really interesting about Nebraska is we were really ripe for a disaster because we had had a lot of moisture that year. This year we're in a drought. Last year we had, in 2019, we had a lot of moisture. Water tables were high, soils were saturated. And then, it's wintertime. We had a really cold winter that year, and it froze. So the worst thing that could happen is that we would get a lot of moisture and a lot of runoff with water with nowhere to go. Well, Ulmer hit the state, and it came through the western part of the state as a blizzard. You can go to the next screen there, Susan. So really a tragedy, especially out there in the panhandle with the blizzard. Some areas had over a foot of snowfall, and it was calving season with several locations with winds close to 100 miles an hour. So as we moved east, and I mean, the pictures are extraordinary, that many of our communities you know, we had nowhere for this water to go, were very quickly surrounded and isolated by water. As we talk further, I mean, the infrastructure damage to Nebraska was record-breaking. Go ahead, Susan. We had these enormous ice jams on the rivers, especially on the northern part of the state. Some of them were the size of pickup trucks. They measured as 3 tons. I don't know if you can show your pointer there of the guy underneath one of those ice. It was like having giant glaciers go down the rivers as we had the rain and the melt and the water flowing, breaking up all this ice that had compounded on these rivers, and it just pushed it through communities, homes, businesses, tore out roads, bridges, dams, and there were lives lost. I believe we were very fortunate. I believe there were 3. But the damage from this particular storm is going to take Nebraskans at least 9 years to recover. The majority of our counties and the tribal nations will all receive either a state or federal disaster declaration. We had both urban and rural Nebraskans impacted. It was a little bit differently in some of the urban areas. Those rural communities where there were farms, ranches, and just towns and villages were completely isolated by the floodwaters and then the damaged infrastructure. On the right-hand side of the screen, you can see the amount of damage we had. It's like $1.2 billion that we're looking at. This picture is, it's an amazing situation. This is the Spencer Dam. They believe it's one of the first infrastructures to be taken out by ice. And it's a huge dam system, and it covered Highway 281. This really was a devastating area because people couldn't get around and were having to drive hundreds of miles just to get to cattle and to towns and to try and get supplies. Last week, this road and the bridge was finally completed, and it's been over 500 days since the flood. So like I said, it is going to take a very long time for us to recover, but that was part of the impetus with our project as well. Go ahead, Susan.
Sorry, I had to unmute. Darn that mute button.
I know it. I better mute.
So we thought we'd just give you a little bit of background. Before all of that impacted our state, our administration had requested that we form this work group to explore the mental health needs across Nebraska. And it's, as you can see, a collaboration of a lot of different entities around the state. We meet monthly, we exchange ideas, we report on things that are going on related to mental wellness, projects, grants, professional development. And they have also been very much impactful on our little Wellness in Tough Times team. So this is the original team. 4 of us went to Atlanta to the E-Extension Impact Collaborative, and then we added Kayla and Carrie later into our team. But the purpose of this collaborative was, it's hosted by E-Extension Foundation, and their goal is to just build innovative team projects that improve the quality of life for our communities. So we went there not really even knowing what we were going to do. In fact, not at all, because we hadn't met each other at this point. But this is where we met, this is where our idea was conceived, and Wellness in Tough Times was born. So basically the project focuses on these rural Nebraska communities that were impacted by disaster with limited resources for recovery. And we did choose specific communities that were hit hard, that didn't have the resources that other communities had. And the goal of our project, the goals are to increase mental health awareness and knowledge and decrease that stigma, because wow, that is something that we have, especially in Nebraska, where we have tough farmers who don't tend to talk about their feelings. So this is a big one for us, getting rid of that stigma. And of course, increase use and or awareness of our resources, our support systems that we have, our hotlines, things like that. So these are the communities that we chose. based on who had limited resources for recovery and who had the worst damage. So this involves over 7,000 households, and it's just 7 or 8 communities, very small, very, very low populations. But it's beyond that. We also began with projects and events and awareness things all over the state, programs that we gave and continue to give on a regular basis, and media campaigns. I think Sonny's going to talk about that in a little bit. But as a result of this impact collaboration, where originally we were given a $5,000 grant to start our project, it has just snowballed. And to date, we've had $260,500, which I converted to $365 in your dollars, $365,000 worth of grant funding that has been offered to us. So it's definitely a topic that funders want to fund. It's very much of interest. Everyone realizes that mental wellness, especially after our disasters, is an issue.
Susan, before I start, do you want to tell people what you do with Nebraska Extension?
See, I told you I would forget, you guys. So hello.
I'm reminding you now. It's all good.
I'm Susan Harris. I am the only rural health, wellness, and safety educator for Nebraska Extension. And that is what I do. I work on anything health and wellness related. All right, now you may go.
Okay, thank you. Okay, and this was really interesting because we had started our messaging with the goal of, helping these folks that are dealing with the ag economy. Then we pile on the disaster. Our funders, I'm going to go back to the funders a little bit, that gave us 2 of the grants, specifically didn't want us working in communities that were getting a lot of media press and look like they might have a source. So it'd be our larger communities, more urban communities in those areas. So that's another reason why we focused on those smaller communities throughout the state. Our media campaign is targeting those rural residents, and I'm sure Kayla will talk about, how we found those results with Husker Harvest Days, and ended up, learning that where folks like to get their information. So we did some of the disaster messages. We worked on social media. We also know that not everybody is on the internet, and in rural Nebraska, we have places where people don't always have really good broadband access. So we did some print articles. One of the things we had focused on after COVID, because now we have more isolation, is we worked on some videos and podcasts for folks. We worked with a direct mail resource, which we'll show here in a little bit, that we were able to mail out to folks. And we do have a website where we're putting these videos and websites, resources now that we actually can't get into communities. This is a resource list that we have provided our extension colleagues and our communities, and it's on the right side. It's a lot of the hotlines, the National Suicide Prevention Hotline. Let's see, what's the statistics on hotlines? It's completing suicide is 10th rated death in Nebraska. Is that right, Susan? Okay. And so it's really important that we got those messages out about suicide awareness, suicide prevention, and where people can reach out. We have these little wallet-sized cards. They are in English and in Spanish language that people can slip right in their wallet, right in their truck. Really handy. We've also got little holders. We've put these in businesses where people can pick this up with the Rural Response Hotline, and again, the National Suicide Prevention Hotline. These were really, really popular. This is our website. It is in the process of being revamped. It is ruralwellness.unl.edu. And the Wellness in Tough Times team has a section on this with our resources. And in addition, there's quite a few other resources on here about general stress and wellness, and a lot of that focus on rural people. Let's see, I've got some information here on the Communicating with Farmers Under Stress. That's one of the workshops that is ongoing, and we have programs coming up. These are done virtually now during COVID. I'm correct, Susan? Correct? Okay. If you go to that Rural Wellness site, it will give you some more information, but I know there's one coming up in November. But this workshop is for ag professionals and people that work closely with farmers and ranchers. You know, it might be your banker, your feed store, your veterinarian, those kind of examples. And what it does is it shows people, you know, some of the things that they might see when they're working with folks and how to direct them to where they might be able to get resources.
Yeah,
17.
Tony, I'm gonna interrupt. Sorry, the next workshop is November 10th, and you all would be welcome to attend. And I think our registration would be on that website.
It is online. I know it is. So it's on that ruralwellness.unl.edu, and absolutely you're welcome to attend that. There's been 17 free workshops to date throughout the state, and over 465 folks have participated in those. So we hope to keep those going. We wish we could do them in person, but virtual option is working out. On the right-hand side of the screen is our Start the Conversation Bulletin. And we've got 2 issues, a spring issue and a fall issue. And these are mailed to those 7,000 households in the Wellness in Tough Times project. It's got a variety of resources. This is the fall issue, talking about, you know, where you can get help, recipes. I think there's the one, what is the one that we've got this month on food in the field?
Yes.
Right. It's about taking food out to farmers who are harvesting now. So we thought that was a great little piece to put in there. There's an article on gratitude, and we're working with campus on a chat line, which is manned, staffed by therapists on campus. So we're working with them on that. Okay, so we got Carrie coming up, and Carrie will introduce herself.
Hello, everyone. My name is Carrieelson, and I am a 4-H youth development educator. And what you're seeing on the screen now is a group that we locally put together for the section of the state that I'm in, which is really close to right in the center of Nebraska. And we've labeled ourselves Neighbor to Neighbor. And so this is a local task force that we put together shortly after the flooding occurred as a response to just reaching out to our rural communities and our farmers and ranchers and helping them to kind of get through a lot of those challenges that they were running into, especially right around the mental health concerns that we knew were beginning to happen. And so the task force that we put together was made up just of a group of volunteers. Many of them, some of them were farmers and ranchers themselves. We also have some folks that work with behavioral health, so we needed some experts along the way as well to kind of guide us, as well as we had a number of folks that work in the industry. So farming, lenders, feed salesmen, local auctioneers for farmland, all kinds of different ag business folks were a part of that. And so we pretty quickly put together some ideas and some things that we knew needed to start happening right away in those communities. And so the piece that you see here is a flyer that was put together that was distributed to a number of ag businesses, helping to educate them on some of the warning signs of mental illness and then how to proceed from there. So how do you start a conversation with someone that you might think is struggling, whether that be your neighbor, a coworker, somebody that you're working with, and just how to start that conversation and what to do as that conversation took place. From there, knowing that a lot of us rely heavily on our communities as a support system, we brought those communities together. We have 7 communities within our county that have a population of above 150. So we held 7 community events where we served a meal and brought those folks all together. These were all free of charge. Served that meal and had an expert come and talk about those different warning signs, how to have the conversations, and just to let folks know that there's really people right next to you that care about you and can be right there to help you through some of those struggles. They're amazingly well attended. We were often met with I hope you come back and bring us some more information, which we did the following January. We talked a lot about, at the next event, we talked about stress management and what that maybe would look like, and again, how to rely on each other and how we can be there to help each other through those challenges, and then where to go past your neighbors. And so we had another set of events in January at 4 of those original 7 communities, and had plans to continue in August, but just like many other things, COVID shut those down. And so we will be headed back to those communities as soon as it's safe for us to do so. So definitely pulling our community members together to support each other. And I think Kayla is up next.
All right, thank you, Carrie. My name is Kayla Hendricks. I am a food, nutrition, and health extension educator. And this is Husker Harvest Days, where it's a very large outdoor ag show. And so we were there last September. We had iPads set up, and we had people that would complete surveys, and we purchased some hats that said Nebraska Strong that people were very crazy about, and they would even come back the next day if they didn't get a hat. So it was kind of fun. We had 471 usable surveys as a result of that, so a great number. Some of the things that we found out included that the major stressors in 2019 were work and financial concerns. The top 3 ways that they felt they dealt with stress is talking with others. The second was isolation, or isolating myself. And then third is counseling or therapy. When we asked them what supports are needed in your community to help cope with stress, they listed counselors, educational programs to learn better ways to deal with stress, and then they would like to see information to learn how to deal with stress. I think that was more like in the written format. So we had just seen earlier in our presentation this evening the wallet cards that we were handing out that evening, or the multiple days of the event. And we would just say, you know, we'd like you to put this in your wallet. And if you or anyone you know is experiencing high levels of stress, we would like you to know that there are people that are caring and willing to help you. And so we just encourage people to hand those out. And one of the most touching things was one of the gentlemen that I handed it to, he said, "That's really funny that you give this to me." He said, for years and years, a group of 5, myself and 4 friends, have come to Husker Harvest Days together. And he said, our friend recently committed suicide, and I appreciate you handing these out, and I will definitely put it in my wallet and share it with others. And so it was kind of like, wow, I realize now why we are here doing this. And there were lots of people just very, very grateful. And so we were glad to be able to share in that format.
I might add too that we have distributed over 31,000 of those cards throughout the state at this point. They are pretty popular.
So I'll introduce myself. My name is Michelle Krabel. I am a youth development specialist and an associate professor at the University of Nebraska, Lincoln, and my office is in Lincoln, Nebraska. My colleague, Dr. Lisa Franzen-Castle, we're going to be splitting our time talking about some of the assessment. So I do want to kind of talk a little bit about, Kayla talked about the assessment that was taken. It was a survey, and you can see that the senior citizen there, the elderly man, was working on the kiosk taking that. That was a statewide, pretty much a statewide assessment on what people were experiencing, some feelings, behaviors, and so forth. What we also talked about, and what we know is good community program, was working with local community needs. So with these communities that Sonny talked about in regards to ones that we're going to do an in-depth programming, in-depth work with, we felt like we needed to do some more community needs assessment. And so with that, we did a mental and physical health related quality of life assessment. This was actually developed by a graduate student at the University of Nebraska, Lincoln. Dr. Franzen-Castle helped work with that. And so she can talk about that more if you have specific questions about that. But we interviewed 18 people from 5 different communities. Myself and Sonny were the ones that conducted those interviews. We had 14 people complete the survey. So if you interviewed, we had you complete this 31 question survey. Out of this, we had 13 females participate in the research, 5 males. The age range was from 25 to 64. I think this is a pretty important statistic that almost half of them lived in the community for over 16 years. We identified these community leaders that we wanted to talk to about how they perceived the mental and physical health related quality of life issues. And they were from all walks of life as far as occupations, whether it was education, healthcare, business, government, and so forth. So the next slide talks about some of the results. And in the survey, we ask about attitudes and perceptions of community leaders, as well as the organization that you're associated with, as well as the entire community. And you can read this, but as you see the community, the response about community leaders was yes, they seem to be pretty willing to work with mental health issues and quality of life issues, as well as looking for things outside of the community and for new ways of doing things. And you can see the response rate there. The next question was, you see the response rate kind of dropping down when it says, do people in your organization see mental and physical health related quality of life as an issue? And almost 70% responded, yeah, moderately, that's okay. But when the next question to me is really interesting, is the entire community aware of mental and physical health related quality of life issues as a public health issue? You got 50% saying slightly. And that to me is really interesting about when you look at the perceptions of what they perceive the community leaders doing, what they perceive their own organization doing, and then what the entire community is feeling as well. So if we go to the next slide, which is results of the themes from the qualitative part, and I've been working on analyzing those. Several things happen, and I'm going to kind of skip around here a little bit, but one of those was community culture. And as mentioned already, in rural Nebraska, and I'll say it's kind of a United States Midwest, the perception or culture value is people are good at helping each other, but they're not good at asking for help. And that came out over and over and over again. And so we can see that with some of our survey results. I certainly got it in the interviews. One of the things that we also got was, I can go help my neighbor. And that was their way of relieving stress or feeling like they were valued. Some of them talked about physically shoveling out muck from a basement was their way of kind of helping. And it was their way to actually kind of even physically feel better. One of the challenges is we had the disaster of the flood. The interviews that I did took place during COVID when we were in shelter-in-place orders. And so several of the people I interviewed said it was one thing to experience the flood, but now we have to experience COVID. And that was really devastating. Several communities talked about we were just getting back on our feet, and now we had COVID kind of really kick us in the gut. Community events were extremely important, where it was communities had community celebration. These communities were less than 500 people, and so you could physically do that, where you had meals, churches put on meals. There was one community that celebrated the opening of a bridge. When the bridge got built, they celebrated that, which I thought was great. Several people talked about the local high school being a place where people talked with one another. We talked obviously about community leadership. There's also several community issues. Infrastructure was a huge issue. So whether it was there wasn't running water because the disaster took out your water supply or electricity or roads. Roads were a really big thing. So there was just a variety of community resources. And then there was a variety of resources people used: schools, churches, businesses. And so just some really interesting things with that. So Lisa's going to talk about program evaluation a little bit here.
Hi, I'm Lisa Franzen-Kessel, and I'm an extension nutrition specialist at the associate professor level, and I am in Nutrition and Health Sciences Department, also in Lincoln, Nebraska. And I work with a lot of teams on program evaluation, development, strategies, reporting, and analysis. And so some of the program evaluation efforts that have been used with this team have been from the Mental Health First Aid Training, National Health Nutrition Examination Survey on Social Support, CDC's Health-Related Quality of Life Healthy Days measure, as well as some of the internal evaluation strategies that were developed by the group that were discussed earlier as well. And then what Michelle just talked about, the community readiness assessment that was conducted recently. And so some potential next steps include identifying a common set of questions and indicators that could apply to programming implemented by this group to look at aggregate data that cuts across efforts, as well as identifying assessment pieces and questions that are specific to different programs to capture those unique attributes. It will also be really important to document cumulative reach and impact through things such as indirect reach, which were talked about, like radio, TV, newspaper circulation estimates, the mailing list, the handouts, the online presence, and the community events, as well as the direct education program reach and impact, which we've done in the past with those program evaluations, pre-post and post-pre formats. And then also looking at the number and depth of partnerships that the Wellness in Tough Times group has developed, and what is Wellness in Tough Times providing to those partners, and what are those partners providing to them, looking at that relationship as well. And then also documenting success stories, and then any policy, system, and environment changes that may occur as a result of this team's efforts, which I think they definitely have the potential to do that. And so additionally, looking at different ways and best practices for distributing assessments based on mode of engagement with participants will also be important. Examples of previous modes of delivery have included online and hard copies of surveys, as well as analytics from website traffic. But with transitions to more virtual and online opportunities to reach participants, given the situation we're in with COVID, exploring innovative and easy ways to build an evaluation to these experiences and to reach participants will be really important in the coming months.
Hey, and my name is Brandy Vanderwall. I am a 4-H Youth Development Extension Educator. And I'm working on really the youth component of this project. So now that we have the communities narrowed down and starting to get some of those themes and everything figured out, we're working to incorporate some outreach activities, not only for adults, but for the youth. Those youth experience the trauma from disasters in multiple ways. And they also see that additional stress that it causes, mom, dad, other adults, and the community members. So, reaching out to them is really important. So our team's plans in the near future is to develop some professional development, first of all, for our own extension staff on youth mental health and helping them cope with the continued aftermath of the disaster. Like Sonny said, this is about a 9-year time that we're going to be dealing with this. So once our extension staff become more comfortable with some of those key mental health and wellness concepts, our hope is that they'll be able to teach their own 4-H youth and adult volunteers on some of the kind of mental health and wellness issues, using some guides that we're working on to incorporate some hands-on activities, as well as kind of some reflective exercise pieces. We've also researched some other interactive and engaging delivery methods to consider doing in our communities, such as a dinner theater approach. The key element that makes kind of a farm dinner theater effective is that it changes the behavior in the involvement of the local community. So youth can become these actors, along with other community members, and they're relatively inexpensive and effective for families to start those conversations that can actually lead to some substantial behavior changes and foster that collaborative community engagement. Our Nebraska Extension staff also has a Read for Resilience program that our early childhood development team has already created. And in that program, they've identified books that help support children's coping and understanding of their feelings after a disaster or loss of grief. And so we've explored utilizing some of these storybook guides with adults or teachers to utilize, and even having some of the older youth kind of reading to the younger youth to work out on that. So as we continue to engage communities in these conversations to identify their projects, we'll just continue to tailor each outreach effort to meet the particular needs of that community and its culture as you know, they all have their own different needs. And I'll let Sonny talk about the e-extension support.
Thanks, Brandy. You know, as you were talking, and you're absolutely right. We learn that disasters are local, and I know Michelle is going to share this as well, that, you know, in visiting with these community, every community is different. They're unique. Their culture is different, and their access to resources. So we're very cognizant of that as we work forward, working with our communities, and we're really excited to do that. We were just recognized, the Wellness in Tough Times, a toolkit. It's been identified as one of the new technologies for agricultural extension projects. There are 8 projects, and we were selected as one of them. E-extension is providing a whole group of wraparound services to pull together an e-field guide that will be put online, that's going to be able to be used by extension colleagues, you know, I'm sure around the world, like you folks would have access to it as well, to see processes and how we're doing these events, how we're going to get into these communities and work with our communities. And then the other component of that is we wanted to make sure that we had a resource for what we're calling community champions, our key stakeholders who are going to lead these efforts in our communities. And that toolkit is part of that e-extension project.
Okay, so as you can tell, we are kind of passionate about this topic, and we did kind of use up all of our time here, but if you all have questions, we would be happy to answer them. And here is our contact information as well.
Thank you very much, Susan. And thank you to all the team. I think I've seen there has been some chatting going on between some of the participants and your members, which is great. And I see there are certainly some opportunities there. I guess a question that I had is, I guess I'm trying to get a little bit of understanding of, say, the level of suicide that's actually happening in rural communities in Nebraska. You alluded to that in your talk, and it is actually an issue that we're facing more broadly in Australia, not only in rural communities, but also, although it is quite challenging in rural communities, it's also happening more broadly as well. I guess trying to understand the level of what's going on there, and I was interested to see that you've got programs to try and address some of that component with actually getting people to talk about these things. So I'd like you, if you could elaborate a little bit on that as well.
We do address that in our Communicating with Farmers Under Stress program, and the beauty of that is that it's reaching professionals, ag professionals, people who work with these farmers day in and day out, who may, you know, ag lenders, they may have these farmers in their offices daily, not knowing how to recognize signs that they're considering something like that. So this program is intended to help professionals recognize the signs, know how to react, know where to get resources, and especially, as we say, the number one thing, just to not leave that person alone. You know, there's so many basic, really simple things that people can do that they may not know, and this program tries to teach that.
Oh, that's great, Susan. Thanks for that. Yes, I've had first-hand experience, of course, with that in my working life, but also actually I lost a cousin to suicide many years ago as well too. So I can really relate to the importance of, in a rural context too, but also relate to the importance of that support network and supporting people. And I think that's really great that you're working with the people who are most likely to be meeting with and seeing farmers and their families in that context as well. I'll open up to other questions from those present. Feel free to unmute yourself and ask the questions.
I'll stop sharing at this point.
Yes, I haven't been looking at. Yeah. Thanks, Heather. I was going to ask you to ask a question.
Yeah, so I guess my question is, probably noticed my feedback through the chat box is, how rural professionals, I guess I'm looking at it from a rural professional perspective, how they feel about managing at their level, about dealing with managing, with feeling responsible for recognising decline in mental well-being. I'm trying to think about it from a rural professional angle. Got some thoughts on that?
We understand that there is some serious compassion, we call it compassion fatigue, when you're dealing with someone taking on everyone else's problems and internalizing it. We are living with that ourselves here at Extension, and I know that we are working to address that with various self-care things. We're starting a meditation, a weekly meditation with our Extension professionals, I believe next week, y'all, is that right? Something like that. And compassion fatigue is very real. We had our USDA employees come to us and say, our field workers are just stressed to the max because they are dealing with these farmers and ranchers. What can we do? And so we would take this program to them and try to help them out. But it's a tough one. Does anybody else on my team have anything to say about that? I know that we're doing our best to address it, but it's hard.
Michelle, I know you were on the team that is working on the employee wellness piece, correct? Website? I think she's still there.
Yeah, sorry, I've had a hard time getting myself unmuted. Yes, and Heather, to your question, I guess I would say, what professionals are you talking about? Because in those interviews that we conducted, if you were looking at it from you were a school counselor, you would maybe see it differently than maybe a clergy person, or if you are a owner of a local business. And so, you know, that's you ask a great question, but the question is difficult because I think it just depends on a little bit about your background and what your knowledge level is of mental health resources, and certainly prevention of mental health resources.
I think, yeah, so actually for like rural professionals in New Zealand and also in Australia, they're the people like the vets, the accountants, the lawyers. And I raised this point because we had a big drought here, and one of the vets I was talking with was just stressed out because all the farmers were coming to him because they were stressed, and he didn't have the ability or the resources to be able to manage what he needed to do and deal with euthanizing animals, as well as dealing with the stress that his farmer clients were facing. So it's a big discussion that's not being had in New Zealand about how rural professionals manage the stress that farmers feel. So I was just interested in your thoughts around that.
Again, excellent question. And I think about my home state of Kansas that had some really bad fires, and where vets had to put down a lot of animals who were burned in the fires, devastating to them, really hard on their mental health. We don't have the answers, I don't think, here in the United States. We're trying to figure some of that out. But it is something, mental health general in the United States is lacking, and certainly in rural areas. And then when you compile that with, you've got people who are working in kind of really informal mental health ways that are kind of now put, like vets who are dealing with farmer stress, that's really difficult. We certainly haven't addressed that well in the United States.
And then the comment that I'd make from the Australian perspective, yeah, similar thing here. Again, the fires earlier in the year had devastating impact, and certainly having to euthanize animals, your own animals, and also being involved in doing it yourself has had a big impact. From a work perspective, we've certainly seen in the organisation I work with, which is a government organisation, we've recognised, have started to recognise some of the impacts that that the stress is actually having on, and drought obviously being the main one, but also fires, on the people that we're dealing with, our constituents. So we've had to try and come up with strategies and programs to help our staff. So we've run an incidental counsellor program has been one that's been operating a little bit to date in our organisation, but yeah. So there's a lot more work needs to be done, I'm afraid.
Absolutely, and I'd be really curious to know some other things that you're doing, because I think this is something that would be really fascinating to learn, again, internationally, what's happening with this effort, because it is a huge need.
Yeah,
Susan,
no,
I'll share. Oh, go ahead, Graham.
No, you continue.
Just real quickly, and it kind of sounds maybe along those same lines, but I know in Nebraska, after the first round of disasters, we had crisis counselors that through our Department of Behavioral Health were able to work in those communities that had individual assistance declarations. So they were able to help those families that had that declaration from the federal government and not a lot of the rest of the state. But now that the entire state has been declared a disaster with COVID, these Nebraska Strong crisis counselors, they're trained, they're guided through our State Department of Health and Human Services, and they are operating statewide on a regional basis now. So that is a resource for folks to get people out in the field.
I was interested in some of the discussion about the community activities and getting people along, and also there was a comment which rings very true in Australia, and I suspect the same in New Zealand, but Heather would know better. Male farmers are less likely to seek support historically because of the stoic male approach, and a lot of the pressure comes onto the women that are in their lives. That's obviously something that you see there in Nebraska, and how would you rate success to date in addressing some of that issue?
We actually have some data back from our Nebraska Rural Response Hotline, which is the #1 on that card, on the wallet card that we handed out, which, by the way, after we handed out those cards and we're promoting it heavily, they had an all-time high of calls. And they also are reporting now that they have 55% of their callers are male, whereas it used to be mostly women. So that's an extraordinary change, and that's very hopeful to me that maybe those guys are finally understanding that they need help and they're picking up the phone. So 55% is looking good. It's getting better.
Okay, and is that, do you feel that's sort of the anonymity is getting the males to actually take on board that phone call first? Yeah, exactly,
because they don't want to pull up to the counselor in their hometown and have everybody see them do that. This is a much more discreet way.
Okay.
So one of the positives of COVID that I did hear come out in the interview was there were more less restrictions on telehealth and more availability of telehealth. And so that's one of the things that we are seeing that is a positive piece of COVID, is now if I want to seek a counselor, and those resources have been more widely made available for all Nebraskans, that you can see a therapist via telehealth. And so I think that's a really positive thing out of COVID.
Excellent. John James, I saw you put a text in there and I didn't actually catch it actually, so I wondered if you wanted to speak to that.
So I'm just aware of it, Graham. So it's started in Queensland, but it's now spread across Australia, and they seem to be getting really good results. They've won a few awards of late.
Can you explain that a bit further? Sorry, I didn't actually see it. I just saw you just quickly popped up on the screen, so I just wanted to share it verbally.
I think I've heard of that, the Are You Bogged, Mate? I love it.
Yeah, I pulled up the website. It looks really interesting. We'll have to take a look at that.
Oh, yeah. Are You Bogged, Mate? Yes. I actually know the lady who, she's an extensionist, working in private sector now and worked in biosecurity for many years too. So yes, Mary O'Brien. It's very good to have a look at what work she's been doing. Yes, most definitely. Sorry, John, I didn't pick it up until I just checked what it was. So yes, Mary O'Brien's A above, mate. Yep, excellent. Are there any other questions of our Nebraskan team at all at the moment? If not, we've probably got a few people joining us now for our AGM. So I would like to really thank the Nebraskan team and Wellness in Tough Times project. Looking forward to having a closer look at your resources because I can see some real value in having a look at those, and if other things come to light, I'll actually share some of the things here in Queensland and Australia as well. So I'd like to just issue a thank you to you all for speaking to us today. Obviously very professional at keeping the time too, which is always good. And I would like to, again, thank you for taking time out of your evening to actually meet with us today and explain to our people here at this webinar some of the background and also what's happening and obviously what is planned to continue happening in the space around this really important area. So thanks again.
Thank you. We appreciate you asking us, and I think this could be a beneficial relationship both ways. I'm sure you have much to teach us as well.
Mm-hmm.
That's great.
Absolutely. I like Heather's thumbs up.
Okay, very good. Exactly. Well, thanks everybody. Much appreciated. We'll let you get back to your night.